said yesterday in 2020, there's one focus: the health and well-being of Australians, their livelihoods, their jobs, and ensuring that Australia bounces back better on the other side. That's our focus. That's what the government is intently been working on. From the outset, back in January, we moved to get ahead. We've been working hard to stay ahead. And it's important that we all keep our heads as well when it comes to how we're addressing these issues. Every Australian has a role to play, whether you're in a government, federal, state, local, whether you're an employer, whether you're an employee, wherever you happen to be. We all have a role to play, to stay together, to work through this very challenging time, and importantly, on the other side, because there is an other side, that we bounce back stronger than ever. The health response has always been our first response to the COVID-19 crisis that has been enveloping the world. It's a health crisis. It's a health contagion. It's a virus. And that's the first thing that around the world countries are working hard to address and to ensure that the health responses are in place to support our people. There are many other implications of this, and the economic consequences of this are very serious, as I've already outlined on numerous occasions, and tomorrow the Treasurer and I will be making announcements in relation to that response. But today it is to outline the first response, which is always on the issue of our health preparedness and what we're putting in place to protect people's health. Today, $2.4 billion is being committed in substantively demand-driven programs to support the health and well-being of Australians. Just under $1.2 billion of that will actually, we anticipate, be spent this financial year, particularly as the virus and its impacts ramp up in the months ahead. That health response covers the areas of primary care, support in aged care, support in the hospital system, which I announced last week with the Health Minister, that $500 million in shared support with the states and territories, matched 50-50, which the Premiers and I and Chief Ministers will be discussing again on Friday, and investing in research. Everything from telehealth to testing, to clinics, hotlines, ensuring people can get access to the medicines, ensuring, importantly, that the most vulnerable parts of our community are very much in our attention. And that not just means those who are elderly or frail and in care facilities, but those who are in remote and parts of the country, particularly those in Indigenous communities. And there are specific measures that we're announcing today that go to those issues. We have a world-class health system. That is one of our great advantages. We have an economy and we have a balance sheet that enables us to address this crisis, both in terms of providing for the health response as well as the many other responses, in particular the response that is needed to address the challenges in our economy. Of course, this system will come under stress and it will come under strain. That is to be expected. These will not be usual times and usual demands on our health system. And so I anticipate there will be times where that will come under great stress. That is not a reason for alarm or concern, because the plan and the resource and the preparedness and the professionalism of our health system will attend to those needs. And so it's important that as we go through the months that are ahead, that we all have confidence in that plan. I have great confidence in those, particularly, obviously, Dr Murphy and the tremendous advice that he's provided, together with all of his state and territory colleagues over these many weeks now. The state governments are also very focused on this, the premiers, the health ministers. Of course, our cabinet, led in the health area by Greg Hunt, is doing exactly the same thing. It doesn't mean there won't be stresses and strains. It won't mean there won't be difficult times or days and waiting from time to time. But the surging of these resources into our health system, some $2.4 billion, and as I said, the majority of this is demand-driven. And that means if the demand is greater, then the resource will be provided. One other point I'd make today is we received advice from the AHPPC today regarding regarding Italy. And That advice is that the situation in Italy is now commensurate with the other countries where we previously had travel bans put in place, and so we'll be extending that travel ban to Italy now. That ban will come into effect at 6 p.m. this evening. That's what Border Forces advised me. And effectively, though, I think it's important not to overstate this. I mean, Italy itself has effectively put itself into lockdown with travel now, and this largely closes that loop. We already had the enhanced screening measures that are in place. This, of course, will mean that any Australians, residents or others who are obviously exempt from those travel bans would be subject to the same 14-day isolation period that applies to the other countries for which there are travel bans. So, health first. That's always been our focus. This is a health crisis. We have to address the health issues, and that's what this package of measures is designed to do today. I'll hand you over to Greg and then to Brendan.
Thanks very much,